Hello, everyone. While we provide a moment for everyone to sign in, if you would kindly use the chat box to enter your name and organization that you are representing, we would greatly appreciate that, and we will get started momentarily with today's webinar. All right, well, it is 1 o'clock on the dot. So welcome, good afternoon, and thank you for attending today's webinar, Connecting Data with Academic Research with Environmental Public Health Agencies. My name is Nicole Dutra-Marquez. I'm a Senior Project Coordinator for the National Environmental Health Association. I will quickly go over the agenda. First, I will begin by sharing some details around our Informatics Committee, who put this webinar together for you today. I will then introduce today's speaker and panelists and our Informatics Committee co-chair, who will be moderating the panel discussion today. Following introductions, we will move into today's presentation, which will be followed by a Q&A session. After that, I will hand the floor over to our moderator for today's panel discussion. And lastly, prior to closing of today's webinar, I will share some details about NEHA's 86th Annual Educational Conference that is coming up later this year. With that, allow me to cover a few housekeeping items before we get started. Please note this webinar is being recorded and it will be uploaded for viewing on NEHA's website at neha.org for anyone that was unable to attend today's live webinar. We ask that you utilize the Q&A box at the bottom of your screen to drop any questions you may have for the speaker and panelists. At the conclusion of today's seminar, you will receive a link to take part in an evaluation survey where you will be able to provide feedback and comments on today's webinar. With that, let's begin today's seminar. The mission of NEHA's Informatics Committee is to be a resource for environmental health professionals and leadership dedicated to developing informatics resources and programs to increasing workforce capacity and to fostering improved data utilization to protect environmental public health. Our committee is tasked with several activities. Some examples include identifying gaps related to data and informatics knowledge and training to be able to provide or recommend solutions to meet the needs of the environmental health workforce and any emerging issues. Identifying best practices, highlighting successes, and solving challenges faced by environmental health professionals in regard to data utilization. Providing partnership, guidance, and recommendations in the development and continued expansion of NEHA's informatics program. And promoting and disseminating data and informatics related tools and resources. NEHA's Informatics Committee is comprised of local, state, federal, and industry professionals with environmental health informatics and data expertise. So we ask, why is data important to our environmental public health field? NEHA believes that adopting the use of informatics and reliable data is a foundational pillar to decisions in all of environmental public health. Data that is collected can make an impact on core environmental health functions across all fields, such as food, safe drinking water, aquatic facilities, on-site wastewater, air quality, vector monitoring and control, just to name a few. This webinar will focus on environmental health data, which is collected in academic research, as well as at state, local, tribal, and territorial agencies. We will discuss how these data and research can be connected better to be able to impact policy and practice at all levels, and how it has and can be used to identify emerging environmental public health issues. Ultimately, connecting data from academic research with environmental public health agencies can lead us to be better equipped to better protect environmental public health across all state, local, tribal, and territorial areas nationwide. With that, let me introduce our guest speaker today. Dr. Nandita Gaur is an assistant professor of soil physics in the Department of Crop and Soil Sciences at the University of Georgia. Dr. Gaur's research focuses on incorporating advanced sensing techniques like remote sensing and geophysics to understand soil physics. Some applications of her research include understanding water movement and contaminant transport under different land uses and land covers, and enabling the use of remote sensing data for agricultural and environmental applications. Dr. Gore and her colleagues at the University of Georgia have collaboratively worked with Athens-Clarke County, Jackson County Northeast Health District, and the Metropolitan North Georgia Water Planning District in Georgia to answer several research questions centered around septic systems. Dr. Gore, the floor will be yours in just a moment. I just want to remind everyone to please enter any questions that you may have for Dr. Gore into the Q&A box at the bottom of your screen, and we will address them right after the presentation. But Dr. Gore, please, the floor is yours.
Thank you, Nicole. I am just going to take a second to share my screen. Okay, can you all see my screen?
Yes, it is up. Thank you.
So again, Nicole, thank you for that introduction. And I am, like Nicole mentioned, I am an assistant professor at the Department of Crop and Soil Sciences at UGA. And I would like to talk about connecting data from academic research with environmental public health agencies from an academician's perspective. And when I was putting this together, I thought from the work that we've done in the past, and we often talk about this with our colleagues, I thought we could talk about identifying challenges and then creating opportunities from them. So just a quick opinion on how we view, or at least I view, the role of environmental public health agencies is that the environmental public health agencies really have the pulse of the local community, and they have intricate knowledge of local and regional health. Through issues that come up to them, they probably have this information way before it actually makes it to the news, which is when a lot of the times academicians get to know about things that are happening, and then they would actually go in and maybe collect data to assess what's going on and why it is going on. So that mechanistic understanding would only come, will begin to be investigated after an issue is brought to light for an academician. So I do see that the environmental public health agencies have access to some data, like I will show you in just a little bit, and they understand what the local community needs in terms of health. And a perspective on what academicians do at universities, we're really good at reviewing literature. Say we find out there are issues that are impacting people locally or regionally, we can quickly dig into literature, find patterns, figure out if this issue is being experienced elsewhere, and kind of analyze things together. We're also pretty good about having access to labs, advanced technology, students who we can train as a workforce. And environmental health issues and public health issues tend to be an interdisciplinary problem. So in university setups, we do have access to different expertise through our faculty to tackle complex problems. This one's a little tough, but we can also design and teach relevant coursework to train the outgoing workforce with the skills needed. But we need good interaction with the actual environmental health office for that. We foster collaboration, and then we can also leverage upon local, regional, and national funding resources. And I'll give you some examples maybe during our panel discussion on how we've done that in the past to tackle on problems that may be affecting a small community, but really require a lot more resource monetarily. And then finally, the most important thing is we publish citable documents that can be used, that are peer reviewed, and that you can hand out and read, and that's evidence-based research. So that's what academicians do at universities. And I thought I'll start out by talking about a few successful collaborations that I at least see as success of how these collaborative efforts and data sharing has worked for us in the past. So just a quick background, I know you're probably all familiar with it, but a lot of the work that my colleagues and I have done have centered around septic systems or on-site wastewater treatment units. And they are, or they can be, a non-point source of nutrient and fecal pollution. And at least in Georgia, they're of concern to several water planning districts. But the issue that we got hit with every time we wanted to understand these systems, figure out how they are possibly causing pollution, we were hit with this roadblock of a limited availability of this data set. And a lot of the data that was available was in the form of paper records and environmental health districts, even though Georgia's made huge strides in trying to digitize that, but I think we're still ways away from where we need to be. So I've put up a picture here of Dr. Krista Capps, who's really the person who spearheaded these collaborations with the counties across Georgia. And we collaboratively published a paper in 2020 where we assessed the socio-environmental risks of septic systems to inform management level decisions. And this work was possible because Athens-Clarke County, who's phenomenal at putting data together, they had a GIS, or they provided us with a GIS layer of septic systems, which actually dates back to Krista's work with Athens-Clarke County, where she sent in a student to Athens-Clarke County, established a relationship with them, and that student helped digitize all of that database into an ArcGIS system. And then us at the university, we had access to other environmental level variables, and we assessed the risk of system failure due to environmental variables and system conditions. It was interesting because we also overlaid census block data on this. So we were able to look at the risk of failure associated with demographics, which was an interesting part of the study. So we were able to do some meaningful research just because of data that was provided by the county. Another thing that we looked at, again, with collaboration with Athens-Clarke County, was to look at risk of septic system failure and system level variables that could cause that. So we looked at anomalous pumping. The idea was, since the county had pumping records and we do not have good failure data on septic systems, so we used anomalous pumping as a key indicator of when septic system failure might have occurred. And we also use repair records of septic systems around the county and use that as an indicator of potential failure. Upon assessing that kind of data set, and it was a task to get all of that data into the format we needed for the analysis, but once we had done that, we found that systems that were really old, no surprise there, greater than 50 years old, or newer systems between 2 to 10 years old showed higher signs of failure. And again, this data was, this study was only possible because of amazing collaboration between Athens-Clarke County and University of Georgia that we've established. Another collaborative effort, which was statewide and I think really pertinent, was a collaboration between Georgia Department of Public Health, the wastewater operations at Douglas County Water and Sewer Authority, Athens-Clarke County, the Metro Water Planning District. And here we were able to analyze state level data that highlighted discrepancies between the state's capacity to treat septage and the amount of septage produced. Again, great, amazing studies that were only possible because of the data that was provided or that was shared by all these environmental health agencies with us. Finally, this is something that's still ongoing. It's called SALT. It's a septic system automated location tool. And we've been collaborating with both Jackson County, Georgia, and the Northeast Environmental Health District, where all these septic system records are housed. And we're trying to come up with a low resource method for populating a septic system database for counties who probably do not have access to either to good GIS resources within their system. But really, our heroes for all of these studies, even though we get the credit of publishing them, are Ms. Cheryl Shaw, Mr. Dave Bloyer at Athens-Clarke County, who have now since retired. But they really did such a great job of co-locating data, and they did it off their own because they shared our vision of doing this. And when we met them, it just clicked. Mr. Mike Coffipenti at Athens-Clarke County, who's great, and they share data with us. Ms. Kelly Hinson at the Northeast Health District, Ms. Gina Roy and Mr. Joel Logan at Jackson County in Georgia, Mr. Danny Johnson from the Metro Water District, Mr. Tim Callahan from DPH, and so many others. I probably haven't written everyone else's name here because I just can't really fill the screen, but it's only possible because of fostering collaborations with all these amazing people at these environmental health agencies. So Coming back or zooming out a little, I think as academicians, and it's something that we've learned when we've established these communications and exchanged data, the first challenge that I think is finding the right people to connect with. A lot of the times people, or all the times, people aren't really being paid to do this, to connect with academicians and do what we do. So there has to be some sort of shared vision between the people, and they should be willing to maybe do the extra work a little to share that data with us. Data in standardized formats is not always available, which we can work with because we have the students to work on the data, but sometimes getting data in the right format takes more time than the analysis itself. But that's something, if we're talking or discussing this in an open environment today, we can talk about. Access to data is again a big thing. There can be privacy issues pertaining to data sharing. Do we go in and use the data at a county computer or the environmental health district's computer, or is the data okay being shared with us on our university computers? So that's also something that that we need to think about. Then as academicians, we do collect a lot of data, but oftentimes we're limited in our ability to collect spatially distributed data for large scale studies. So for like regional and national studies, oftentimes just because of logistics, monetary or otherwise, unless we've been funded, there can be limitation. But I think the data collected by the environmental health agencies can really feed into that space there. And then another challenge, which I think is perhaps the most important, is fostering collaborations and maintaining that human touch. Like I said, no one's getting paid at these agencies to do this. And it's out of the niceness of their hearts, their shared vision, that they're doing it. And if there was some means of, having those channels open all the time, that would really go a long way in furthering this collaboration. Collective challenges that I think of are, if we do have to go this route and if you have to make this really effective, data sharing agreements, and I don't know what they might look like, but there has to be some sort of data sharing agreements so that both parties are satisfied and no one feels cheated, more so for the environmental health agencies, I believe, who graciously share data with us all the time. I think channels of communication, again, need to be open all the time. There has to be common vocabulary as we think of grand public health challenges. Sometimes, even within academicians, we talk about the same things with different vocabulary. So that can be a challenge when we're communicating. Data access and privacy is something that we need to really look into, talk about, and then fostering communication. That is perhaps the most important element of this entire thing. Effective communication, I think, helps us get over a lot of the other challenges. Just something that I wanted to throw out. There are grand challenges that our environmental health, public health is going to be experiencing, and it already is actually. And two of them, I think, are one, climate change. Climate change induced extreme weather events, or just extreme weather events in general. They are changing our understanding of the system. If I have to talk from a soils perspective, the behavior of soils, the property of soils change under extreme climate conditions. And because soils have such a function in treating, say, on-site wastewater systems, or they control runoff potential and hence control the amount of pollution that gets carried off to, say, receiving water bodies, we need to think of this effect as just together. Emerging contaminants, emerging contaminants like PFAS or antibiotic resistance bacteria and things like that. This is also a challenge that can only be collectively addressed by academicians and environmental health agencies. This is sort of open-ended, but I will probably just leave it there. Thank you for listening to me. I had this little schematic of when I was thinking about this, where data is collected by one person, probably, whose gears are churning in their head. But through effective communication with people who can analyze data, people who are in the heart of the problem, through effective analysis, we can probably come up with solutions. And we've seen that this has happened in the past. I have other examples too that display that. I just wanted to add a little something here. When we think about informatics, and if you're thinking about going large scale, cloud resources are something that we could consider, obviously after considering data sharing and privacy issues. But this is something that we could talk about perhaps today if the panel goes in that direction. But I do believe communication and collaboration leads to solutions, and that is where we should focus a whole lot on. Thank you.
Thank you for sharing your work and your thoughts, Dr. Gore. We will address any questions from the audience at this time. If you have any questions for Dr. Gore, please do submit them in the Q&A. Dr. Gore, I do have a question for you already related to your work. What is the definition of a failure in a septic system?
Interesting question. So we define failure, or at least literature defines failure in 3 ways. One could be a failure that the homeowner notices immediately. The system clogs up. It could be the leach field, it could be the tank itself, and you see a backup in the house. So that's one type of failure. And most often the the homeowner would notice it immediately, go out and call someone to pump out their system possibly. Another failure could be a failure of the leach field, where your tank itself is trying to push effluent out into the leach field, but the leach field isn't doing what it's supposed to do. It's probably overloaded by either rainfall or just septic effluent, or the soils, the biomass increased. The thickness is increased beyond what it should be, and the effluent starts to surface. So you're going to start seeing effluent ponding in the backyard or wherever your leach field is. The third kind of failure, which is perhaps the most easy to miss, is the leach field is not backing up, the effluent's not ponding, but the soils are structured such that the effluent, without being treated to the extent that it needs to be treated, is passing the effluent to the groundwater. And that's really hard to figure out. Eventually, when it'll show up in either a groundwater well, or if it'll show up in the receiving surface body through base flow, is when that kind of becomes obvious. But those are, or they could be leaking septic systems too. Those are the 3 main kinds of septic system failures that literature suggests.
Great, thank you, Dr. Gore. We have another question for you. I am curious about septic failures for systems older than 50 years versus systems that are relatively new. Did you find significantly different reasons for the 2 groups?
We wanted to find reasons for that, but unfortunately, we do not have the right data to go into the reasons. At this point, it can only be speculative. Older systems, we tend to expect failure, but yeah, we did not have the kind of data we would have needed to figure out why that might be happening.
Thank you. Another question for you. I was just curious why both the older systems, greater than 50 years old, and the newer, 1 to 10 years old, both appear to have the same problem. What is the common denominator?
Again, it's like the previous question. I don't think we had the data to answer that, to look into the mechanism of why that may be happening.
And another question for you, Dr. Gore. To take full advantage of the spatial information, what data besides the parcel info is useful to have in the septic data layer?
Oh, this is a good one. We've been thinking a lot about this, and I think one of the really important data sets to include would be soils data. And I may be a little biased, but I do think it's really important. So when we did all of this analysis, the soils data that we had to use was a database that NRCS had created, and they've created that for the entire continental United States. But septic systems are not permitted based on those soil data. They're based upon a soil scientist actually going into a site, doing a level 3 or level 4 soil survey, and it gets permitted based on that. And you can see a lot of variability in soils within the same parcel itself. So this information typically gets attached to the septic permit. I've seen permits, and not always is this information on the permit itself, but it may be somewhere in associated documents. So if we were to take full advantage of the spatial information, I think including soils data in the parcel or in the septic data layer would be of tremendous help.
Great. Thank you so much, Dr. Gore. Any last questions for Dr. Gore before we move on to panel? Oh, yes, one more for you, Dr. Gore. I apologize. Did you identify a system type or technology or a specific installer or engineer that had disproportionate failure rates?
No, we did not even have the data to answer that. And actually, maybe that's an interesting question that we could think of including in our septic data there. Yeah, but we did not have that information at all.
Great. Thank you so much, Dr. Gore. All right, now I will introduce to you our guest panelists who will join Dr. Gore in today's panel discussion. Joining the conversation is Dr. Craig Hedberg and Mr. Tim Callahan. Dr. Hedberg is a professor of environmental health sciences at the University of Minnesota's School of Public Health and has been a Minnesota Department of Health's principal academic partner in the Center of Excellence since 1999. Dr. Hedberg is one of the few academics who has made foodborne illness surveillance and outbreak investigation a primary focus of research, teaching, and service. Specific focus areas have included the timeliness of surveillance and outbreak investigations, enhancement of outbreak detection algorithms, use of clinical and epidemiologic criteria to guide lab and environmental assessments in outbreak investigations, and development and use of improved exposure assessment and traceback methods. Tim Callahan has worked over 30 years in various roles of environmental health, including 7 years in the U.S. Army, some time in industrial hygiene in the private sector, and 12 years as a county environmental health specialist. Since 2007, he's been developing, implementing, and managing a statewide environmental health data system to support daily field operations and improve general policy decisions. He completed his fellowship in the CDC's Environmental Public Health Leadership Institute in 2009 and earned his MPH from Augusta University. So now I will introduce today's panel moderator, who is also the Informatics Committee co-chair, Carla Shoup. Carla is the Environmental Health Manager for Southern Nevada Health District's Consumer Health Section, which consists of an aquatic health plan review and operations teams, plan review for food, childcare institutions, and body art, and the operations teams manage the inspections for childcare institutions and body art. Ms. Shoup is a Las Vegas native who earned her Bachelor's of Science in Zoology at the University of Washington and her Master's in Public Health from the University of Nevada, Reno. Over the course of her professional career, she has enjoyed working in physician offices, managed care, and public health in various capacities. She has worked at Southern Nevada Health District for 16 years, with 10 years in leadership roles. And with that, I would like to invite the audience to also engage with today's panel and remind everyone to please use the Q&A box for any questions or comments. And now I will pass the floor over to Carla Shoup.
Thank you, Nicole. And thanks to our panelists for joining us today. We had some last minute changes, so we're very grateful for everyone for sticking in there. I'm going to start with Dr. Hedberg. We heard from Dr. Gore as to how her university is using data. How have you seen universities and other research organizations making use of the data collected by public sector agencies?
Sure, thank you. It's a real pleasure to be here this afternoon with this. My background, as it was mentioned, is really I was trained as an epidemiologist and did a lot of work doing food safety work, and I've been at the university now for 20 some years. But one of the things that I think I've been part of a movement to try to build better collaborations between the practice world and the academic world, and I think that a lot of the work that I've been doing has been to try to work with data that are being routinely collected in the public health system, whether they're disease reports or in the environmental health world. We have a very rich set of data around restaurant inspection work that is really hazard surveillance, documenting conditions in restaurants that put people at risk for foodborne illness. And so a lot of the work that I've been doing and my students and colleagues here have been to really work with the local agencies to understand that work better, to try to build connections between agencies to share data, and then to apply that data to streams of disease reporting, and really make some new collaborations that help us better understand how the restaurant inspection process can lead to better prevention of illness.
Great. Going back to Dr. Gore, you showed us how your agency is using the data and some of the studies that you did. How can public sector organizations help increase your research use of data?
I think one thing that I always think about is connecting research and making it easily accessible to the public. So that is where I think public sector organizations would come in. Also collecting citizen science data, sometimes that's really useful in the kind of work that we do, could be helpful, and also education are the things that I can think of. So connecting, another thing that I think the public sector organization can contribute to is connecting researchers with environmental health agencies, the right agencies to work with, who's collecting the kind of data that's out there. That is pretty helpful too.
Thank you. Tim, Dr. Hedberg, did either of you have any other thoughts on that?
Go ahead, Tim.
I'll throw out that one of the things I've heard from many of the partners I've had with academia is the lack of standardization and the diversity of different agencies out there. In 2019, the journal Journal posted an article about, I think they said there were 2,800 different environmental health agencies across the US. And then on top of that, you have folks like a company called Hazel Analytics that tries to scrape our food data, put it into one data set. They're only successful with 1,500 of them. So that standardization, even just making it available, is probably, those two items probably be the biggest push I would suggest for trying to get more academia and public agencies working together.
You know, one of the things I'll throw out there, and Dr. Guard talked about students, and access to students is one important resource that academics have, and I think that there is much more opportunity than we've taken advantage of using students to work with local agencies in the context of understanding and analyzing their own data. You know, unfortunately, most environmental health programs aren't funded at a level that really allows them to do a lot of the operational, sort of applied public health research that we really need. And having students come in and work alongside the professional staff and get access to data that could be used as part of an academic project that they get credit for, helps train the student, and it provides capacity to do analysis that might not be present in the normal operation of the agency.
That's a great point. And I'm going to kind of go off script a little bit here. You know, at our agency, we get, you know, annually, we get the request for interns, you know, from the university. Do you see, any of you see a way we can kind of go beyond just the traditional internship type of opportunity for students to work with EH?
So maybe I'll take a pass at this. Our students have been working with these environmental health agencies for their master's thesis projects, typically not a PhD for now, which probably might grow into that. And I think that's been a great space for them to collaborate. Like it gives them the time they need to foster an effective collaboration. They can actually do something meaningful with that data set that feeds into their thesis. And longer term internships would be useful, but just forming some sort of system where students can come in to the health agencies, use that data, answer research questions specific to their master's thesis has worked out for us in the past.
Great, okay. Data-centered storytelling skills are needed in the EH workforce. It's how we move our boards and our directors and our community members to act. How do you support advancing storytelling skills in the curriculum of your university?
I think it's a fabulous question, and I totally agree with the need to do that. And I don't have any secret sauce for doing that, other than that I would say that you know, the students that I'm working with right now are much more creative and competent at telling stories than people of my generation are. And I don't know if it's because of the time they spend on social media or what, but I would say that, you know, I'm very encouraged with how adaptable our students are at developing and resonating with stories.
I think I concur. I feel like that's right on point. Another thing that that happens is that in the curriculum, sometimes, and I can think about soil physics because that's what I teach, we're so focused on teaching concepts and tools and techniques that sometimes there's a trade-off between what you can teach in a course like that, which obviously has practical implications, but you know, just getting two people. But so several universities like UGA also has extension faculty, extension agents who are always working with environmental health agencies, for example. Students associated with them, I think, are way better. So that's a career path that students are allowed to select. If when they work with extension faculty, for example, they do get trained a little in the art of storytelling around this.
Great. I have a question from the audience. I'm going to go ahead and interject right now. This is from Milton, and he says, I am aware of both academic institutions and public health departments that separately conducted community environmental health surveillance. I'm curious to know if partnerships between the two entities are being used or are feasible for such activities.
Well, I think the short answer for that is probably yes. And you know, one of the challenges in a session like this, and actually in the field, environmental health is such a broad field. There are so many areas of activity that fall under the environmental health umbrella, from in monitoring air pollutants to water source monitoring, and my area of foodborne illnesses. I think there are opportunities for engagement between sort of academics and public health agencies to sort of take each other's skills and find common endpoints that can be addressed by them.
Thank you. Are there specific areas of environmental health for which you would like to see more data?
Well, I'm a food safety guy, and we keep talking about how things like salmonella, we have not made a dent in the occurrence of salmonella, despite many years of regulatory activity by FDA and USDA's food safety and inspection system. And I think one of the reasons for that is just the complexity of salmonella as an organism and how it gets transmitted. But I think this is an area where within our environmental health programs, there is a ton of data that is being underused to look at this problem. And so it's not really a new area, but it's a new application of information that that there are challenges in putting together, but I think give us a great opportunity to actually make some fundamental improvements in our food safety system.
And from the wastewater environmental health perspective, I think emerging contaminants, antibiotic resistance microbes, or PFAS, nanoplastics, all of this needs more data for us to look into. These are the challenges that the future generation is going to face when they think about drinking water safety. And I also think we need to think about this from a little more interdisciplinary perspective, in the sense that the transport, retention of all of these emerging contaminants is so tightly or so intimately linked with weather patterns that changes the dynamics of when things reach surface water or groundwater, that it needs to be looked at from that joint perspective or that interdisciplinary perspective of weather and environmental health.
I have another question from the audience. I think this is maybe for Dr. Hedberg, maybe for both of you. It kind of overlaps. Says this person is curious whether you have any microplastics-based food poisoning data.
The short answer for that is no.
If I may, I'd like to throw out a comment on the last question about types of data that I'd love to see academia help with the agencies putting together, is essentially the metadata, the stuff that describes what data is available, so that there's possibly some cross-pollination between on-site wastewater and food production or water supplies and other things. There seems to be a lot of just figuring out, okay, what do we collect now? Advancing that catalog would be helpful, I think, in the long run.
I think that would be tremendously important, and actually, right now, one of the big issues that we're facing with respect to say leafy green produce is all the potential inputs for contamination in a field of lettuce, and some of these things are things we know, but a lot of them are things that we don't have the ability to really monitor in the environment, and some of it, to get to your point, Tim, is we don't have data on where these potential sources of contamination reside or what's happening there, and having better access to that data would help people investigating these opportunities. It would actually help the produce producers do a better job of managing their sites as well, if there was more access to information about locations of different facilities in the environment that might be threats to those production facilities.
Can I just add a quick point? And this is sort of going back a few questions, but I feel like it might be relevant to bring it up now. So just building off of Dr. Hedberg's point, I think public sector organizations, maybe one thing that they could lend a huge role in is to have sort of, maybe, I don't know if it will be sort of a running database of the kind of data that academicians need data sharing policies, like creating those or establishing those through communication with several agencies. If there is the bandwidth with public sector organizations to do that, or they can create that bandwidth, I think that could be a central key role that they could play for academicians to reach out to different agencies and then figuring out who we need to communicate with, where they're located. Sometimes that can take months and sometimes years to foster the right collaboration. But if there was this median between the two in some ways, maybe that's somewhere public sector can also interface.
I'm going to start the next question. I'm going to have Tim kick this one off. What advice would you give to health departments who are considering allowing public or academic access to their environmental health data?
First thing is talk to the lawyers about what you have to exclude. And then after you figure that out, give them everything. Truth be told is that the diversity of data that you have is probably far beyond what they're used to experiencing. And they'll welcome everything you can give. They'll probably say, wait, I don't need all that, but that's okay. They'll know about it and they'll be able to share it with their friends, and their friends share it with their friends as to what's available. And you can further expand those partnerships. So once you figure out what you can't share, the vast majority of public health data is typically recorded, considered public record, which means it's a massive data capacity for not just the academics to do research, but also for the students to learn how to do the research, how to do policy analysis and other things. So as much as you can, share what you can.
And I would just throw in there that, one of the benefits, one of the things that would benefit the academics more than they even may appreciate is the opportunity to work as a partner with the agency that generates the data. We see a lot of examples where academics take data and then run with it and are analyzing it totally independently of the people who put the data together. And I think that's a mistake on multiple levels. One is, there's a lot of nuance in how data are collected and assembled. And sort of academics working alongside of the practitioner to understand the data and then to develop the ideas coming out of that data, I think is a tremendously important activity that that will build capacity on both sides of the street.
And I'll throw out to that end, I have to agree. That is one element I didn't mention is if you do set up a data sharing agreement, there's nothing wrong. It's an agreement. You can say, okay, I give you your data, but one requirement is you do the research with us and we get final veto as to publication.
Universities don't like to hear that, but
I know they don't. But the reasoning why is because without that, you have to have carrot and stick.
Right.
Without that, oftentimes individuals do grab data and run with it, and we end up with misperceptions of what the data contain, and that can result in nobody likes retractions and such. So it's not out of the idea of saying we won't want you to, but at least it ensures that partnership.
Right.
And I think that goes back to, how we collect data. I know when I even look in our own database that I'm familiar with, and I'm familiar with the parameters in it, there's nuances to how other people are entering the data, right? And what does this mean to them versus what does it mean to me? So even within your own agency, you have to scrub your own data, right? So I think that's definitely valid when you're sharing it with someone.
Carla, Richard Delb has posted a question in the chat box.
Sure. Let's see here. Oh, there it is. I'd appreciate hearing panelists' perspectives on open data platforms as a vehicle for cross-sector sharing and collaborations, and considerations for open spatial data.
I think I'm all in favor of open platforms to the extent that they, can be supported and maintained. I think that's really the issue is how do you keep the data current and credible? And I think CDC has done a lot of dashboard building where they're trying to put some of their surveillance data out there more accessibly, and I find that tremendously useful. But I know that it is also a big activity and a big cost for the agency to maintain that type of data quality. And so that's really the key thing is how do you ensure the quality and integrity of the data that's out there?
Yeah, I completely agree with that. I would love open data. All academicians would love open data, but we've talked about nuances to data collection. So many different agencies collecting that data. Any open data platform would have to have impeccable metadata. It would have to be vetted, and that will be a constant process. So there should be resources available for it. It's too much to ask of anyone to do that without available resources.
I have another question in the Q&A. The key challenge seems to be need more data. Is it about getting the right data sets or getting enough data to make reliable decisions?
I think those are great questions, and both of those things are important. And sometimes the hard job is actually framing the question that you want to ask the data.
Mm-hmm.
Agreed. Exactly. I had the same thoughts on it.
And then one last question I think was in the chat, Dr. Hedberg, this might be for you. Do you have any data on ethnic food poisoning?
Well, most of that is going to come in the context of outbreak data, and CDC collects all the nationally reported foodborne outbreak data in their foodborne disease outbreak surveillance system, which is part of the NORS system, for which they have a nice database. And they do collect quite a bit of information about food and food type. I would say that and they've published something about food associated, I think, with ethnic restaurants more than ethnic food itself in recent years. I'd say the data there are a little bit squishy, and that we've got a lot of work yet to do on that, and probably within individual agencies that have a lot of immigrant restaurant operators, you could probably get better data than you would sort of looking at the national data.
Great. Well, thank you so much to our panelists today for fielding some questions for us. I'm going to go ahead and turn it back over to Nicole.
Great. Thank you, Carla. And thank you all so much for such a great discussion. We have a few minutes left, so let's move on to just a couple announcements here. This year, NEHA is hosting our 86th annual educational conference in New Orleans. That will happen July 31st through August 3rd. The theme is Raise the Voice of Your Environmental Health Workforce. The AEC provides a unique opportunity to network with hundreds of environmental health professionals and those just beginning their careers in environmental health. This year's AEC will feature a pre-conference workshop all of you may be interested in called Tools for Working Better, Smarter, Cheaper as you utilize data and planning to ensure environmental health program success. That will be happening on Monday, July 31st from 12:30 to 4:30 p.m. And let me share that this year's keynote speakers will include Dr. Maureen Lickfield, Dean and Professor of the School of Public Health at Jonas Salk, and retired Lieutenant General Russell Honore, who held the role of Commander of the Joint Task Force following Hurricane Katrina. And you can find more details regarding the AEC at neha.org/AEC. I would like to thank our speaker and panelists, Dr. Nandita Gore, Dr. Craig Hedberg, and Tim Callahan for being panelists today, and our moderator, Carla, for partnering today and bringing great content and discussion to today's webinar. And to our audience, thank you so much for attending. Please complete the evaluation survey for today's webinar. You will receive a link to the survey upon conclusion of today's webinar. We would greatly appreciate your feedback, comments, and recommendations. And please feel free to reach us at neha.org or email us at support@neha.org. Thank you again, and we hope you enjoy the rest of your day.
Thank you.
Thank you.
You.